I think it's very important to discuss, this case. There's a lot of learning points. So this is a very nice patient, as you will see, 49 years of age, an international patient. She comes with a set of implants that she got in the year 2000. These were the textured saline implants. And then, because of her problems that she ended up getting, in 2016, she went to a surgeon, and she ended up getting an explant. And the discussion was with that surgeon that the capsule was to be removed, as the patient explained to me. So the surgery was done in the OR, where the time was less than 2 hours. The incision was roughly this long for what are tear-shaped implants. And no capsules were sent to path. There were no high-definition pictures and videos. And the surgeon indeed was not a believer. And the surgeon said that he had removed the capsules from the sides and from the top, but not on the rib. And so she got this explant in 16, and she said to me that she is behaving as if she still has implants and she still got the hurt. Now she's been to the doctor, she's gotten the full workup. She's young, she's only 49. Back then, 9 years ago, she was 40, only 40. That's like half the age of the current president's age. So she came to me with the many signs and symptoms of breast implant illness. Now, as you will see on the right side, this is the residual capsule plus inflamed tissue. Now, as I went in, clearly, without a doubt, there was not only capsule at the bottom, at the rib level, but on the side, and the top, and the lateral, and the capsule was relatively very thick. And so, as you will see, this is this capsular tissue, really similar to the ones that I've removed previously, and you can see clearly, look at this capsular tissue that's all the way around. Look at the inflamed tissue around, and it certainly shrunk up on itself. And so all of this tissue was removed, all of that inflamed tissue completely, sincerely. Now, this is, I'm going to cut right through this so we can see how thick it is. Very hard, very tricky surgery. So if you ask me, would you rather do a removal of implant capsule and all inflamed tissue to begin with, let's say she come to me in 2016, or would you rather just do this? I will tell you any time of the day, the implant and capsule, because this is always trickier surgery. There's been an attempt to remove the capsule. There's a lot more inflammation, and so the residual capsule alone is a lot trickier than removing the implant and capsule to begin with that first time around. Now what I'm going to do is I'm going to remove my top glove, and we're going to focus on the left side. I never really did touch it, but you can see I removed it off of the rib. The capsular tissue is very much real. Now look at this, how thick this is. This is what was on top of the rib. And you can see, actually you can see the sac, right? You can see the sac, how it has shriveled up on itself. So I'm going to cut right in the middle. You can see how thick it is. And like literally super glued right on top of the rib. And that is what was and is the hardest part of the whole case, including around the breast tissue. So you can see all of this tissue, hard like a rock. So her capsule was relatively very thick. So as I go in, you can see all of this tissue, very hard, calcified, and look at all of this tissue. As I open it up, inflamed tissue, I remove this tissue at the inferior aspect, and I'm going to cut this open right in the middle. So most importantly, she has this video to show and to see, but most importantly, she has the video of the chest wall showing complete removal of the whole capsule, and then the raw rib, if you will, the pericardium, periosteum removed, the fascia of the intercostal muscle removed. And so as you can see clearly, very thick capsule, inflamed tissue, irregular abnormal tissue removed. Now I just want to go ahead and show you. So this is the con explant. The length of time is roughly 4 hours. So you will see, from my experience of having done thousands of these, this is where I will say relatively efficient with time. Remember, this surgery is not about speed, it's about precision. So approximately 4 hours. Look, my first case today took almost 5.5 hours or so, 5 hours. Much larger implant. So approximately 4 hours. We hear of surgeons doing a explant and a fat grafting and a lift in 2.5 hours. I will tell you that's a big question mark. So 4 hours is how long I take, and you will see the YouTube shorts to see exactly how it's done. The length of the incision is roughly the diameter of the implant. So as you will see, she had approximately, I would say 300. We do not know what the size was, but the size was relatively generous so as to allow for visualization. So my incision on her was roughly this big. And you can see this definitely is the incision that's going to hide right in the crease and will allow for me to visualize and completely, safely, definitively remove the entire capsular tissue off of the rib. The capsules are always sent to pathology, so this is indeed going to pathology. The high definition pictures and videos of not only this, but most importantly, the chest wall. So if you ask me, this is the key. If your surgeon can show you this, the chest wall, that authenticates pretty much, along with each one of these others, and certainly the last one, which is very important, that your surgeon does not augment, he only explants. And not only the surgeon, but if this is the LLC or the company that they have, and the entire group is only explanting and they're not augmenting. And what is happening here is you got two surgeons, one is only explanting, so they market themselves better. The other one is only augmenting, so they don't even talk about explants. And so this is where this 5 is being overlooked, if you will. So again, and again, I will see the web, ultimately the patients of that surgeon who are talking about it, they're doing the attestation and basically talking about their experiences, and that ultimately dictates and guides. She knew that her surgeon actually told her he tried to remove that capsule, but he felt that it was too tedious and too cumbersome and too invasive for him to remove, and that's why she was not getting better, and she knew that she had to look for answers. She exhausted all the other workup, and this was an exploration that going into we knew we were going to find the capsules. So essentially, in summary, what it boils down to is the surgeon must be wholly committed from the heart with integrity, honesty, sincerity, with complete total respect, because the patient's post-op recovery depends on the surgeon being thorough and complete and meticulous, going the extra way from the heart. So number one, the surgeon has to believe that, should not be augmenting at all. None of the people in the group, the surgeons in the group, should be augmenting. And number two, the surgeon, so this surgeon met the criteria, number one, because he said, I will go ahead and do it. But number two is the surgeon must and should be able to prove that he has done it, he has removed it completely, sincerely, and that he has done a very complete, thorough, meticulous job. Remember, this is a surgery that many surgeons don't want to even consider. And those who do, they have to be able to show that they have done so many of these. This is not an easy surgery, as you will see that the many surgeons state. So there you have it. This is Dr. Khan, the capsules. So the capsules will be going to pathology to rule out that rare BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology. We will see what the capsules show as far as what the pathologist finds, any inflammation, cells, histiocytes, giant cell reaction, whatever it may be. And number two, and CD30 analysis certainly, ruling out that BIAL-CL. And number two, most importantly, clinically, we will see and hear from the patient as to how she is doing and how she's going to improve from what are the many signs, symptoms, suggestive and clinically consistent with what is breast implant illness. This is Dr. Khan, Executive Plastic Surgery.